thank you for having me here on Sunday afternoon in Croke Park, and it's absolutely lovely to be here with you. And while it's lovely to say a few words and we've got nice presentations ahead, for me obviously the particularly lovely thing to get to do is to get to meet you individually and just get to know this community a little bit better and to understand what's going on in this community and just to be a little bit closer and so that we know each other a little bit better. So that's what's particularly lovely today. So thank you for being so kind to me and saying hello to me in this way. Thank you to Alan and Bindu for having me here and for inviting me and including me. It's a lovely theme of the conference, Connection. It recalls the early days of the foundation in 1972 by a group of parents. Isn't it always parents as advocates? Isn't it always parents as advocates who step up and step across and try to do so much more for their children, yes, but for all of the children whom they don't even know, the children to come to follow, whom they don't even know. And they do so much work for everybody. And I'm constantly struck by that altruism in my job as Minister for Health, the work that parents do on behalf of their children and for other children. As it's a hugely dedicated, compassionate thing to do, and it has created a really lovely support network and support system that has been of huge importance to the people, to those living with muscular dystrophy in Ireland. And so thank you for allowing me to come and join this community today. For 50 years now, this fantastic organisation has been going from strength to strength. I think you support about 4,000 people a day, which is really quite extraordinary, who are living with muscular dystrophy. And that's why the work of MDI is so very important. I appreciate, and I'm learning more and more about the implications and the impact of different types of MD and different types of diagnosis and the different challenges that are very individual that can present for those living with MD and their families. But we really are, and I hope that being here today is a signal that we really are committed to strengthening supports, to strengthening services for people with neuromuscular conditions. In August, we launched the National Rare Disease Strategy, which is broader, of course, but tries to improve services and supports for, I think, 300,000 people in Ireland living with a rare disease, and it's supported by funding of €6.5 million to try to help advance the specific recommendations in that. The investment is really to try to move on health and research sectors, to try to really deliver change for people living with rare diseases, contrary to the way it had been in the past. And so many different patient advocates fed into that very important piece of work, which took a significant period of time. Very many clinicians fed into that piece of work, and I think it's a very, very important piece. I think we can see that we're looking for progress to be shown through new research, looking at ways of repairing genetic variants and damaged muscles associated with MD, which is very, very important. And I think over the last number of years, Children's Health Ireland at Temple Street in particular has participated in several clinical trials for children with MD and related neuromuscular diseases. And in that vein, again, I've just, in the last 2 weeks, I think, published the report of the Clinical Trials Oversight Group, which is a really significant step forward for how, and I'm sure Orla and the other clinicians will possibly agree with me on this, how we can do better in terms of access to clinical trials for people in Ireland with a whole range of different conditions, and to make sure that Ireland should be so much at the front of that. We have an extraordinary research sector, we have extraordinary clinicians, we have so many different pharmaceutical and med tech companies. There is no reason why we shouldn't be at the front of that. And I was even in Brussels last week with my other health minister colleagues. We get together every month or two, talking about pushing ahead in clinical trials in Europe, and how a smaller country like Ireland can partner much better with a country like Spain of different size, and how Irish people can get the benefit of access to that sort of research and to that sort of work by partnering and working better. And that piece of work that enables us to do that has smoothed and harmonised the rules around doing clinical trials, the access to clinical trials, the rules around personal data, for example, and how that's done. I hope that will make life significantly easier for those people who want to participate in clinical trials, which is very, very important. But that's not the be-all and the end-all. There's so much other work to do. I'm very familiar with the neuromuscular service at Beaumont Hospital, and it's wonderful to see Professor Hardiman and her colleagues here, and I acknowledge her extraordinary contribution to that and to neurology generally, but it's wonderful to see you here as always. Of course, in January 22, Beaumont was credited as a centre of excellence within the European Reference Network for Rare Neuromuscular Diseases, which is a hugely significant achievement for our health service, and of course for Service Europe. users. And earlier this year, Beaumont established the ERN, the Euro NMD registry, which is a new evidence base to implement improvements and reduce the differences in clinical pathways and clinical practice in NMD countries, and have much more uniform care experiences, uniform care pathways, and I hope as well create research opportunities and participation in clinical trials. So there has been, I understand, you know, and I understand this through clinicians, that there has been a rapidly changing landscape in the area of paediatric NMD, including the available disease-modifying treatments that improve patients' quality of life and survival. And for NMD, several emerging potential gene therapies are currently in the pipeline phase 3 clinical trials, and we're hoping to lead to new licensed treatments soon. I, of course, and I've discussed it with some of you here, just been particularly aware of the impact of the availability of medication. And, you know, earlier this year I met with MDI and with families facing in particular Duchenne muscular dystrophy to better understand their experience and to talk about the reimbursement process that we are hoping to have with Givinostat. And I, you know, you are aware better than I am that Givinostat have made their initial application, or that the company behind Givinostat have made their initial application back in August, that application was waited for eagerly by the HSE, but we really have hit a block that I struggle with about the company now submitting the next phase of that, and the HSE is there to support them in any questions or difficulties that they may have with their process. We are keen to receive that. As I've said, I've spoken to the Italian health minister about this 3 times now, encouraging him to encourage the company to take that next step. The Taoiseach called me on Friday night to find out how it was going. And I've given all the information to him. He will raise it with Giorgia Meloni, the Prime Minister of Italy, when to try to help encourage, put pressure on the company to make that next stage of the application. And I cannot put it any further than that. I really can't. But I think if we can continue to work together and hope that we get that, because I'm very, very aware of the time sensitivity and the impact that the drugs have. But you know, I think if I could say to you that the role of advocacy is just so important, not just for MDI, it's patient advocacy is so important more broadly. We are here to have this dialogue and to try to work together as a community of patients, a community of Irish people, people in Ireland, whatever way you want to describe that, a community of people in the Irish state, a community of taxpayers, a community of people who experience the health service in different ways all of the time. We all want to have the best possible experience, and mine is an open door for advocacy to try to improve services at every juncture that we can. There are some constraints, there always are, there are technical issues, there always are, but I think honestly you will always find me giving you an honest answer about what's real, what's not real, what's possible, what's not possible. You will always find a listening ear in how can we improve things, what can we do, and a really genuine, heartfelt commitment to supporting this community in every way that we can. So I am so happy to have this, I hope, closer relationship with you now to be able to do that. I am excited. Today is grand for ministerial speeches and so on, but we have a bit of fun to be getting on with as well, I think, Bindu. There's some excellent presentations. I'm told there's a fun room upstairs where there's a pile of lovely children playing and doing, bingo and a whole range of different things, and that sounds like a lot of fun. So I think perhaps you'll stop me whittering on about technical things and just say how happy I am to be here with you today and how much I'm here to work with you, and thank you for having me.